today we're going to go over how to pick a Medicare Advantage prescription drug plan. And so as an agent, I often get asked, how is it that you actually go in and you tell your clients or instruct your clients what is the best option for them? And so that's what we're going to do today. So when we're looking at this, I've already got all the drugs in, I put them in. And what I want to call your attention to is this fluticasone volanerol, which is the generic for Breo Ellipta. And so what I want you to see is whenever we scroll down, we're going to do done adding drugs. I chose a CVS and a Walgreens, and then I'm going done. And then we're doing it for Richland County in South Carolina just because that's where I live. And I'm going to be more familiar with the plans there, but this works no matter where you're at. I would use the same logic in recommending which plan. So once we get here, remember the plan finder always does lowest drug and premium cost. So we see that over here. And then the first one that comes up is this United Healthcare plan right here. Now, you automatically see that the price is $5,472.15 for the year. That tells me that one of my drugs that I have on this list is not covered, okay? Which means it's not going to be covered for anybody because remember, it's ranked from lowest cost yearly to the highest cost. So therefore, what I'm going to do is to check that, I'm going to go in here and I'm going to do plan details. Something's not covered. So let's see what's not covered. We go to the drug coverage section. And when we scroll all the way down to the drug coverage section, what we see is this fluticasone volanerol, which is the generic Breo Ellipta, is not covered. So therefore, what we're going to do is we're going to go up here and we're going to change drugs. And we're going to remove the generic Breo Ellipta and we're going to add in the brand. That is where I tell people to start, okay? So we're going to keep brand versus changing it to the generic. And I'm going to add it to the drug list. And then we're going to scroll down, done adding drugs. And now it brings us back to that same plan that we were already in. But we're going to go back to search results so we can see what it says. And now you see Humana Gold comes up as the number one plan that has the lowest drug and premium cost for the year. And that would be $799.54. The plan has a $350 drug deductible. And then the second one that comes up is this United Healthcare plan with the drug cost being $824.89 for the year. I'm always going to look at these plans that rise to the top first, okay? Because it, again, is the lowest drug and premium cost for the year. And this is going to be for the rest of 2025. So today is January 18th. So this would be from February 1st until the end of December. All right, so this Humana plan looks decent, okay? I like it. And so I'm going to add it to compare. And then I'm going to add this United plan here to compare. And this is an HMO from Humana. This one is a PPO from Humana. The way the Humana products work, though, their HMO is still like an open network. So it's really not a huge difference between the HMO and the PPO. However, I would look and say primary care doctor here is $0, specialist is $30, and for the HMO, specialist is $15. So I'm probably not going to go with this PPO product just because the person's going to be paying more for a specialist visit. So remember, we're looking at a Medicare Advantage prescription drug plan. And so therefore, we're looking at the health side or your medical benefits as well as the drug side. So we have to look at other things when we're trying to figure out which is the best plan for somebody to join here. So I keep that one. And here's a give back plan from Humana. Okay. And so what a give back plan does is it gives you back money towards your Part B premium on your Social Security check. Okay. And some people like those. What I will tell you is they give it to you, but they're also going to take it away from someplace. And so the specialist visits right here is $45. There's no transportation benefits on this particular plan. You can also see the drug deductibles higher. They're going to pay more for drugs out of pocket. And then it has a higher in and out of network and in-network maximum out of pocket for the medical benefits. So someone who is on a lot of drugs like this one and has complex medical conditions, so this person is diabetic, if they got to go see the foot doctor, they got to go see the kidney doctor, they got to see the heart doctor, these specialist visits are going to add up. And so it's probably going to be more than just trying to get some money back on their particular check. So this is probably not a plan that I would even recommend. Okay, you don't always have to have 3 plans. You can just do the 2, or whatever their preference is. Now, sometimes people will say, especially in our area, they'll be like, well, what about Blue Cross? So, I had Blue Cross when I was working and I'd like to have them again. So what we could do too is we could just scroll up and we could do insurance carrier and we could just pick the one that we want. And so here's one, but look at the drug cost, $2,084.38. And then this one is $2,417 because it also has this $19 premium. And so if they're looking at a Blue Cross, and I will certainly show it to them. I like this one, has a $200 drug deductible. The visits are about the same, 17 to 47, yet they're the exact same for specialist visits. Transportation's not covered there, transportation's here, and transportation may not be an issue. If I'm sitting with somebody and it's like, oh, I can get to my doctor's appointment, it's fine, that I'm not worried about transportation. So if that's the case for this particular person, this $0 premium plan would probably be great. Now, I try to stick with plans that do not have a premium. I am of the notion that why pay for a monthly premium if you don't have to, if there are available options where you don't have to worry about paying for that premium. Okay, now sometimes you're going to have to get one with a premium when it comes to any of these products because it may be the best plan for them. However, I try to find one that has a $0 monthly premium. So for this one, it has $14,093.50. This one's $1,350 and $8,900. That's not really that big of a deal. So I'd probably add this one to the compare. Okay, and then when we go down to compare, here's how I would actually have this conversation with my Medicare enrollee. So this is the Humana plan, here's your United plan, and here's the Blue Cross plan. And let me preface this too. Let's say that this person here is new to Medicare, and so they just turned 65, and we're getting ready to enroll them into a plan. Okay, so they're going from commercial benefits to Medicare. If this is someone who already has a Medicare Advantage plan, I'm absolutely going to include the plan that they currently have or are coming from so that they can actually see how it compares with the other plans and what's available for next year. So if we were doing this during annual enrollment period between October 15th and December the 7th, I'm always going to include what plan they already have, what it looks like for the next year, as well as any other competitors. Okay, so right here we've got star ratings. And so we talk about this. So this plan has 3.5 and the 2 on the end have 4. And this is this is the way I describe star ratings to to my clients. I say it's just like when you go to Amazon and you're getting ready to purchase a shirt and you want to know what other people thought of that shirt and what kind of reviews it got. Well, the star ratings is very similar, but it is based off of certain guidelines that CMS has put out, like how well do these plans handle customer service? How well do these plans make sure that you get your needed prescription drugs? How quickly can you get into the doctor's office using their network? All those kind of things is what goes into your star ratings. All right, then health deductible. None of these plans have a health deductible. Drug plan deductible, we got $350 here, $255 there, and $200 here. The maximum you pay for health services, $93.50 here, $5,900 here in network, and $93.50 here. So how I describe this is when you're in a Medicare Advantage plan, there is a cap on the maximum amount that you'll ever pay out of your pocket. So if something catastrophic happens, you will never pay more than $9,350 on the 2 plans on the beginning and end, and no more than $5,900 in network for the one in the middle. Okay? And the reason why that's important is because if you just had original Medicare, which is A and B, and then you had a no supplement plan, then you would be subject to 20%, and that's 20% of anything. So you could go through chemotherapy and have to pay 20% of a $300,000 chemotherapy drug. Then guess what? That $60,000 is on you to pay. In a Medicare Advantage plan, you cap out how much you're actually responsible for. Health premium, there's no premium. There's no drug premium. Part B premium, this is $185. This is set by CMS every year, and you have to continue to pay your Part B premium in order to be in a Medicare Advantage plan. And then down here is where we just compare some of these extra benefits. So all of them have vision, dental, and hearing. That's great. None of them have transportation, but we've already established that person doesn't need transportation. They all got fitness benefits, worldwide emergency, over-the-counter drugs, okay? So the one in the middle does not, and the other 2 do. This is important sometimes. People want to make sure that they got over the counter. Those cards are very popular amongst seniors, okay? And then it just keeps going down. Now you can see here it's got endodontics, periodontics, and then this one does not. So what this tells me is this Humana plan and Blue Cross have comprehensive dental. The United plan in the middle does not have comprehensive coverage. Okay, and then we scroll down and we look at benefits and costs. So we got primary care is $0 across the board. Specialist visits here are $15, $0 to $40 here. In-network, $17 to $47. I often get asked, when is it $0? When is it $40? If we wanted to know in detail, we'd have to go to the evidence of coverage to see exactly what that is. Usually the way I explain it is $0 when you have to go to things that's more preventative. And then if you have to go to maybe like a cardiologist or something of that nature, that is going to be a higher copay, which may be on that $40 end. But to know exactly, you have to go to the evidence of coverage for that particular plan and find out. Diagnostic tests and procedures. I like things that have just a set copay. When you have things in ranges, it just makes it more difficult to have to explain, and as well as the Medicare beneficiary trying to figure out every time they go get something done, how much is it going to cost me because now I'm in a range. But just to know that's why that is out there. Lab services. I like these at $0. Lab services are usually anything in Medicare that is preventative is usually always going to be $0 on Medicare Advantage. Okay. Your MRIs. So there's those coverage. Emergency care is $110 here, $125, $110. So if you've got somebody who's constantly in the emergency room, that may make a difference. Urgent care is $45, $0 to $55, again, is because preventative, and then $10 copay for a visit over Blue Cross. Now that's pretty cool. This is where you get the differentiator from whenever you're looking at something, 3 plans that may have one that has very high drug costs. But if you have someone who has a lot of medical illnesses, then and they go to urgent care, this $10 may be a game changer for them. Inpatient hospital coverage. This is one where you have to really do some math sometimes, especially if you have people that are in and out of the hospital. So for this inpatient hospital coverage under this Humana plan, the copay the member pays is $399 for days 1 through 6. Okay, so for here, you pay $399 times 6 days if you stay in the hospital for all 6 days. So that's $2,394. Over here, if you stay, let's say because the highest one is 6 days. Let's say you're going to stay for 6 days for all of these. For here, you're going to pay $330 for first 5 days, 330 times 5. So you could stay 6 days under this plan, and you're going to pay $1,650. You stay 6 days under this plan, you're paying close to, close to $2,400. And then under the Blue Cross plan, if you stayed 6 days, you're going to do $465 times 2. You're only going to pay $930, okay? And then you can stay up in the hospital up until 90 days and you pay $0. Okay, so this is always a good one to look at. In my opinion, this looks pretty good. So every time you go into the hospital, these copays start over. And so for this person here, if they're spending 1 or 2 nights in the hospital, then they're going to pay $465 for those first 2 days. Now, you may have somebody who doesn't stay in the hospital over two days. So therefore, maybe this plan is better for them because they're going to pay $330 for the first 2 days. However, this is very strong, in my opinion, to pay $465 for the first 2 days versus having to pay a copay over here per day for all the rest of anyway from days 3 to 5 or 3 to 6. All right. And then you have your outpatient hospital coverage. And then preventative services are always $0. And then you get down here to some of the extra benefits or supplemental benefits. So prescription hearing aids, and this copay is $399 to $699. You can go up to $1,249 with the United plan and up to $999 with the Blue Cross total. Usually with the hearing aids, they just have a standard model, like a base model, and then they may have a premium model. Over-the-counter hearing aids, these are just that coverage, and then they're not covered over here. Preventative dental. So this is one section I don't like about the plan finder. It doesn't tell you how much you get in preventative dental either in the comprehensive dental, like what's the max for that year. You have to go into the plan to do that. Or I have a cheat sheet book that I get from the broker, and it actually has some of these plans in it. And I go in and highlight what the dental benefits, hearing, vision is. so that I can just have it as a quick reference. But all this is going to tell you on the plan finder is what your copays are going to be. So it has preventative dental across all. Remember, the United plan didn't have comprehensive, what you're seeing here. And so this is just giving you your copays. And then your eyeglasses, that vision's not covered under United. So if I have somebody who has wears glasses, then make sure I point that out, that they do not have any eyeglass coverage. Transportation, we saw that wasn't covered. DME, which is that durable medical equipment, is 20%. Diabetic supplies, this is going to be important because remember, our person that we're looking at here has diabetes, so they would pay $0 for their supplies, or 10 to 20% coinsurance. That just means that they have a preferred product. So they may prefer you use one set of testing supplies over another set, and if you use the preferred ones, you pay $0. Over here, United says $0 per item, and same thing, 0 to 20% with Blue Cross. And then we get down to the prescription part, and this is usually where the game changer comes in at. I could literally go through all of that with somebody, and when they get to the drug portion of it, they're like, okay, all that up here was great, but there's no way I'm going to pay $1,200 more for my drugs than I would on one of these two plans, okay? And so with that being said, they'll probably go ahead and cancel out this Blue Cross plan. That's just usually how it goes. Now, that doesn't say that happens all the time, but that's one reason why I like using the plan finder, so that people can actually see all of their options. As I go through all of them, they can themselves can decide which ones they absolutely don't want. And then what happens from there is it becomes a toss-up between these two. They're like, well, which one do you recommend? Like, these look very similar. Well, what I usually do next is I want to make sure that their physicians are in the network. And so right now in South Carolina, we know that Humana does not take any physicians that's within an MUSC network. And MUSC is like our teaching hospital here. So if I know I'm working with somebody who uses MUSC physicians, I probably wouldn't have even shown them the Humana plan. I would tell them about it. Maybe they're having a bad experience with that doctor's office or that hospital, and they're like, you know what? I've been trying to get out of there anyways, so I'm fine with looking at Humana and then changing physicians. I have people do that. That is fine. And then I would show them the plans. So right now, what I want to do is I would figure out, are there physicians in the network? What are some of the fringe benefits that they would want to do that may not be offered? So if comprehensive dental is important, then we're not going to look at this particular plan. Okay. So let's go back to plan results. Now, so let's say this is we don't want to do this one, and then we don't like this one because it doesn't have comprehensive dental. Let's say that they're not using an MUSC physician, so Humana's still in play. They've got other hospital systems because we are again in Richland County, so they can go to Prisma or Lexington. So that's not an issue. And so let's go and find another United plan that actually has better dental coverage. Okay. And so let's see if we can find a United plan that has better dental benefits. And so, yes, so this one has endodontics and periodontics, and the difference in the drug costs is probably like $180 some odd dollars more, depending on where they're going. Okay. So this now is a better contender for the Humana plan. Well, I'm going to tell you and show you one more thing. Remember, our person has diabetes, and so there are plans that's known as special needs plans, and they're ones for people who have a chronic or disabling condition, like diabetes, heart disease, cancer, dementia, or stroke. That is called a CSNP, so it's chronic special needs plan. If this person had both Medicare and Medicaid, that is called a DSNP, so it's a dual eligible special needs plan, meaning they have Medicare and Medicaid. Or they are in a long-term care facility, that is called an ISNP, so it's an institutional special needs plan. So because this person has diabetes, we're going to ask the plan finder to show us plans that actually have a plan designed for folks with chronic special needs. So this right here is a CSNP, okay, from United, and we would add this to compare. Okay, and so now what we see is our plans is still at 0. We've got $93.50 versus $6,700. This one now has transportation benefits. And the cool thing about chronic special needs plans is they have to build out a model of care plan for patients with these disease states. So therefore, you're going to see a little bit more benefits and supplemental benefits than you would in a non-chronic special needs plan. So I tell people, don't sleep on these if you have someone who has one of these chronic special needs. I also know that this chronic special needs plan from United offers $84 a month in 2025 towards healthy food and over-the-counter. And I know for sure that these two Medicare Advantage plans do not. They have over-the-counter benefits, but it's going to be per quarter and not every month. And you can't use it on food like you can with this CSNP. And then they have the comprehensive dental. Okay, so all of this stuff is here. Again, we'll just go back through it. We see the specialist visits are up to $30 a visit. Is Humana plan still strong with this $15 specialist visit? So I wouldn't count the Humana plan out. And I probably would count the one in the middle out, though. $395, $399, $395. Yeah. If I got to pick between these two, I already know I'm going to pick this complete care over this particular plan. And even when I scroll down and look at the drug prices, like this one's even more. So I would get rid of this one. And now it's going to be between Humana Gold and this UHC complete care. All right. So now you got to go into the fun part, and you actually got to go and see what is actually covered. Now, the cool thing is you can go into from here and you can go directly to the plan website. What happens when you actually go into the plan website from there? You actually then have to start over, so to speak. So I would put in the zip code again. Now, I would not have to do this if I went into my portal that is for United and pulled up everything, or if I use my trusted sheet, which is what I usually use, and I know what the plans are. I do my research ahead of time. But for this exercise, I want you to see how you can actually do it from the website. So Richland County, I have to go through it anyways to see if their physicians are covered. So I might as well just go in and pull everything I need. So we're going to go Medicare Advantage plans, and we're going to select special needs because we already know which one we want. And then you make sure that you got the right name. So you got UHC Complete Care SC1. And then when you go over here, it's UHC Complete Care SC1. So you want to make sure that you got the right plan. And we do UHC Complete Care SC1. And so from there, what we're going to do is we're not going to add drugs. We can add our doctors and dentists. But first, what I want to know is I want to know the details of this plan. Okay, so here's the stuff that we didn't see on the plan finder, like the limit. So over the counter and food credit, there's $84 every month to pay for OTC products. Okay, so that's pretty cool. So I told you about already. Insulin's $25, but we don't have to worry about that because this person's not on insulin. And the dental benefits are $1,000. Okay, so although it has comprehensive dental, it's only going to give you $1,000, and they can use it towards cleanings, fillings, and crowns. Now, this is for comprehensive dental. Their preventative dental is still going to be $0, and it's part of this dental allowance. Go to plan documents, and we go to summary of benefits. And this right here will tell us a whole lot more information than we have right now. So they're even giving you 40 cents back on your Social Security check. And this just is going to go into more details. So here's how preventative services with no $0. What are those preventative services? And here they have them listed out. Here's our routine dental that we just talked about. Here's our vision coverage. So I will let them know they get $300 for eye care. Okay, here's the over-the-counter credit. So it's $84 every month. And this tells you where you can shop, places like Walmart, Walgreens, etc. So this still looks like a strong plan. So what we would do is we would then go in and we would look up their physicians. All right. And so we go back here and we have to click this again. You're done. And we're going to add doctors and dentists. So this is where you go in and you're going to add the doctors and see if their physicians are in the network. So let's try and remember some people's names here. Okay, so if they're going to this person here and click the button and then we click save. Let's see. And there we go. So you would pick the people. If you type in a physician name and it doesn't come up, it's more than likely they're not in the network. But what you're looking for is to make sure that they are in network. Okay. And so that is what we're looking for here. If you have somebody that's not in the network, then this is where you want to make sure that you let the client know. And if you're the actual client that's watching this video, this is what you're looking for. You want to know if your physicians are in the network or not. Okay, so for this one, that one's fine. Then we have to go back and we're going back to our plan comparison and we want to see what same thing for Humana. So you would go into Humana and you would do the exact same thing. I'd go into their website and it's going to ask you to do something very similar. All right, and then we choose our county. Okay, and we're looking for the H5619 152 Humana Gold Plus plan. 152. Right here. So Humana HMO 5619 152, that's what we're looking for. And so we do the same thing. We go in here, we add our drugs, add our doctors. But what you can see over here is this got $2,000 a year for dental allowance, whereas United only had $1,000. And they give you $150 towards glasses, where United gave you $300. Okay, and then you see $25 for 3 months for over-the-counter. All right, so those are the three things that we wanted to call out that was going to be different from the United plan that we saw. So then we'll go to add doctors. So I'm just going to show you, since I know for sure who's not in their network, is not in the network, because this is an MUSC physician that I am looking up. And let's see if I got somebody else that is close. So this one might work. BAUKNIGHT and search. Yeah, so this is telling me, which is what I knew already, they're not in the network. So let's do the same person that we had for United. And actually, you know what? I might have did that wrong. Okay, so when I type in Frable, they only come up with William Frable. The Frable we had looked up earlier was Coleman Frable. So that tells us that Coleman Frable's not in his Humana's network. And then the other person we had was Dr. Dingle. And so when we search this one, we see Tolliver Dingle here, so we can add to my list. So for this one, I could tell the client, or you, if you are the client watching this video, that one of your physicians is in the Humana network, the other one is not, okay? And so now what we have is United has both their physicians in the network. Humana has only one of their physicians in the network. So for this one, I would choose the one that has the path of least resistance, because I've got both of my physicians covered in the network. I know all my major hospital systems are going to be covered. So I would recommend for this person to go into this United Healthcare plan. So that is how I walk a person through which plan they should actually pick for Medicare. As you can see, that was about 30 minutes. Okay, so these visits do take a while if you do it properly and you do it thoroughly. And then you could literally get right here like we just did, and somebody may say, you know what, well, let me look at the other plan that may have the drugs cost a little bit more, and let me see what those look like so I can make sure all my physicians are in the network. So whenever you're looking at a Medicare Advantage plans, there are a lot of levers that you got to look at in order to make sure that somebody is set up for the right plan. With that being said, I'm going to create a separate video trying to show people how to pick between different prescription drug plans, which are standalone products versus a Medicare Advantage plan. So if you have any questions, please drop them in the comment section below. I'd love to get your feedback. Let me know if you like it from the Medicare.gov site, or would you just prefer somebody just tell you which plan to go into? Like, just give me some feedback as an agent and as someone who's creating this content on what is best for you. So thank you, and I'll see you in the next video.